Hello, everyone. Welcome back to my channel. I am Dr. Odoy from Oasis Women's Functional Medicine. Today, we are diving deep into a topic that's at the core of many health challenges, which is the relationship between chronic inflammation and development of chronic diseases. So, whether you are struggling with heart conditions, diabetes, autoimmune conditions, or even cognitive decline, it is so important that you understand the connection between chronic inflammation and chronic disease so that you can reclaim your health. Now, inflammation is a natural protective response of our body to injury or infection. So, you might be familiar with acute inflammation, like the redness and swelling you see at the site of a cut, for instance. Over time, you see that the cut will become a scar tissue and it will indicate healing. This is beneficial and is short lived, and that's how we want to have it. However, when inflammation becomes chronic, meaning that it's lingering on for months or even years, it quietly damages tissues and organs. And this low grade persistent inflammation or damage of tissues and organs really sets up the stage for the development of chronic diseases such as type 2 diabetes, heart disease, stroke, Alzheimer's disease, autoimmune conditions such as rheumatoid arthritis, and lupus. So, research has shown that chronic inflammation is really not just a symptom. Although we don't sense any symptoms, it can be simmering and can be causing this like low grade damage of our tissue. So, when we look at the development of cardiovascular disease, it starts with this low grade damage of our arterial, the lining cells in our arteries. And this is the bedrock or the formation of plaque. It's really, it starts as an inflammatory response. And that's how plaques end up forming. And that's how people end up developing heart disease and strokes. When we look at type 2 diabetes starts developing maybe 5 to 10 years before you will get an A1C that is abnormal. So within that 5 to 10 years, like when you are having chronic inflammation going on, it starts to impair the cell's sensitivity to insulin, and it leads to insulin insensitivity, which sets you up for type 2 diabetes. So if you see the connection, type 2 diabetes starts developing 5 to 10 years before you will ever get a blood work result indicating that you have type 2 diabetes. And in terms of the development of autoimmune diseases, persistent inflammation can trigger immune system to begin to mistaken your healthy cells as foreign and begin to invade them, and that's what sets it up for the development of chronic disease or autoimmune disease such as rheumatoid arthritis and lupus. And we can look at other conditions such as cancer. So, with persistent inflammation and chronic damage of tissues, the cells are just always in repair mode. And part of repair mode is division of cells. So, if you know anything with cancer, it's basically the cells division just gone out of hand. And so, chronic inflammation really sets you up for development of cancer. So it's really important that we recognize that before a chronic condition develops, we start with inflammation. And inflammation that's unchecked then obviously leads to the development of the chronic disease. And so, if that's helpful, you realize that chronic diseases can be prevented. At least 70% of them can be prevented by managing inflammation. So, what sets you up for chronic inflammation and persistent damage is poor diet, a diet that's high in processed foods, sugars, refined sugars and unhealthy fats. So that sort of diet, which is the standard American diet, can lead to, development of chronic disease. That's no secret, right? The other part is chronic stress. Chronic stress leads to the persistently elevated cortisol, which can, set you up for chronic disease. Lack of sleep, because your body is not getting enough time to regenerate these repair cells. Environmental toxins is a big part of development of chronic diseases. So how the good news is that some of these things can be dealt with. You can't change your genes, right? If you are born into a family where type 2 diabetes, strokes, heart disease is very prevalent, you cannot change that, but you can change a few things such as your diet. Adopting a high anti-inflammatory diet, which is rich in fatty fish, berries, healthy seeds, and nuts, can really help reduce inflammation. The other aspect is managing stress, prioritizing your sleep, regular physical activity. It doesn't have to be like a 1 hour stay in the gym. It can just be movement on a daily basis, can help reduce inflammation. And also limiting your exposure to toxins, whether it's through your food, your water, and the environment that you live in. So at Oasis Women's Functional Medicine, we view chronic inflammation as a complex, multifaceted issue, and it requires a real personalized approach. Our goal really is to prevent the development of chronic diseases way ahead of time. We like to be proactive. And we take a look at your inflammatory markers. We also look at your gut health to make sure you don't have a leaky gut, because that's a sign that you have chronic inflammation going on. So, with these factors, we develop a personalized plan to help get to the root cause of chronic inflammation that's going on in your body, and eventually to avoid chronic diseases. So we also look at targeted supplements that can help you with chronic inflammation. I've done a video about the link between chronic inflammation and vitamin D, for instance, and it goes into details about the role of vitamin D supplementation in prevention of chronic inflammation and prevention of chronic disease. So if you are ready, if you are proactive and you are ready to take charge of your health and reduce chronic inflammation for better quality of life, I invite you to book a discovery call with my team and I, so that we can work together to create a personalized plan to help you face chronic inflammation and to treat it at the root cause, because we here at Oasis Women's Functional Medicine, we are all about getting to the root cause of disease. We don't want to develop the disease. We don't want to be on medications. We don't want to stay on medications forever, because these medications have real side effects. And these side effects might sometimes require more medications. And what I have seen is that people are still not doing well even with all the medications. So it is so important that we stay proactive about our health. And one way is to get to the root of chronic inflammation. Thank you so much for watching. If you have found this video helpful, um, give it a thumbs up, subscribe to the channel, share it with people who you think might benefit from this information. Remember that understanding the root cause of your health challenges is the first step towards a healthier life and a life that's full of vibrance and vitality. Stay well, and I look forward to supporting you on your journey.